Look, what news would you like to hear that you thought, yes, I think we're getting on top of it? What would the numbers be that would persuade you that we were entering safer ground?
Well, I think actually the thing I would most like to hear is that the majority of people who get this have no symptoms at all, and we have no way of telling whether that's the case at the moment. But what we are seeing at the moment is an increase in numbers around the world. And I think we have to be realistic about this and start planning on the basis that an epidemic is likely to occur globally. And if it happens globally, it'll happen in the UK.
Why do you suppose, earlier today, Professor, we've been taking a look at some of our colleagues in Europe, and we note that in France there's 212 cases and tragically 4 fatalities. In Germany, 187 current cases, 2 critical. Italy, you'll be aware, 3,000 odd cases, 79 fatalities. Relatively at this time, the UK seems to be faring better. Why might that be?
I think it's for 2 reasons. I think part of it, and we have to be honest about this, is going to be that we have been lucky and not having some importations that people missed. But a lot of it's down to incredibly hard work by NHS staff and Public Health England staff who've been identifying cases really early and then isolating them so in a way that, and then following their chains of contacts in a way that means that it then doesn't get into the community. This is a very good way both of containing it if it is containable, but also of slowing down the spread so we delay it, and that is very important for us.
Do face masks help prevent coronavirus?
The face masks are useful only if people actually have coronavirus or another kind of infection. If they have it, they can be useful to reduce the possibility of someone passing it on because they catch the droplets when they sneeze or cough, but they are not effective in reducing it significantly if you just wear them and you're well yourself.
Professor, I note that in the US, pharmaceutical companies are preparing to move to human trials of a vaccine next month, April. If you're aware, where is the UK with that?
So the UK has some of the best vaccine scientists in the world, and there are many people here who are also studying vaccines. But I think the thing for your listeners to remember is the early trials will do very quickly, but you then need to do much larger trials to check whether they're safe. And then you need to work out a way of safely manufacturing it. And I think everybody who understands vaccine production and testing knows this will take at least a year, even if we have a very good vaccine that enters the trial process at the moment.
How comfortable are you with what's happening at British airports? I note that at other countries they have scanners, they have tests, and here, currently, unless the situation's changed, we seem rather more relaxed, Professor.
So what we've done is followed very much what the scientific evidence said we should do, and we've looked at all the things which you can do, including things like stopping flights. And what that demonstrated was it made almost no difference. It would do, for example, if we'd stopped all flights to China, that would have delayed things by probably at most 5 days. And it's notable that, for example, Italy, which is the country which did ban flights and was much more aggressive, is actually the country in Europe which has had the most cases. So we have followed the science on this, and that implied that our efforts are much better directed elsewhere, as I said at the beginning, at finding the cases as they occurred and then isolating them, following their chains of contacts.
And what's your recommendation concerning, you and your colleagues' recommendations concerning schools?
So at the moment, we are clearly recommending that unless there are operational reasons that a school should close, and that's entirely up to individual schools, we are not recommending closing schools at this point in time.
And if we look lastly at other pandemics, the Spanish flu back in 1918, which, as I recall from history lessons, actually killed more people than World War I. It was that virulent. What lessons have been learnt through the years, and swine flu and Asian flu and others, that can be employed here?
So we're obviously in a much better place to combat epidemics now than we were at the point we had that particular flu pandemic. One of the things that happened in that pandemic was a lot of people got a second bacterial infection, and we have antibiotics we didn't have before, and we have much better medical treatments. So, and we also understand epidemics much more than we did at that point. So we are much more able to delay them and to reduce the peak of the curve by a variety of interventions.